Good morning and welcome. I'm Dawn Argula, CEO of the Livermore Valley Chamber of Commerce. Thank you for tuning in for an update from Dr. Nicholas Moss, Public Health Officer for Alameda County. Joining me today are my chamber partners, CEOs Inga Houston from Dublin and Steve Van Dorn from the Pleasanton Chambers of Commerce. And thank you to Amos Productions for producing today's event. This is being streamed live on YouTube, and a recording will be posted on our chamber websites. To all of our viewers, after a brief update, Dr. Moss will take questions. Please post your questions in the Q&A feature to be read to Dr. Moss later in the program. Before we introduce Dr. Moss, I invite Inga and Steve for any opening comments.
Hi, good morning, Dr. Moss, and good morning, everybody. Thank you for tuning in. Thank you, Dawn and Amos Productions, for putting forth this effort in collaboration with Pleasanton Chamber and the Dublin Chamber. Thank you.
Good morning, everyone. Welcome back, Dr. Moss. Thank you for spending time with us. And thank you, Dawn, for arranging this. And of course, Jody, we appreciate your support. This is a great opportunity for our business community and residents to learn more about the things that you're dealing with on a daily basis. So we really appreciate you getting into the details, and we look forward to having a really good discussion today. So thank you.
All right, thank you. So I'd like to give a formal introduction of Dr. Moss. This is our fourth webinar with you, and I have not really done that. So just giving a little background on you. Dr. Nicholas Moss was appointed as the County Health Officer in November. Upon the departure of Erica Pan, who previously served in that role before being appointed to the Center for Infectious Diseases at the California Department of Public Health, Dr. Moss served as Interim Health Officer. Dr. Moss is an infectious disease medicine specialist and medical epidemiologist by training and has been with Alameda County Health Care Services Agency Division of Communicable Disease Control and Prevention. Dr. Moss has a bachelor's degree from UC Berkeley, Doctor of Medicine from UC Irvine, and trained in internal medicine, infectious diseases, and public health at the University of Washington, Seattle. And during this pandemic, Dr. Moss and his wife welcomed a baby boy to the family. Welcome, Dr. Moss.
Good morning, everyone. Thanks, Dawn, Inga, and Steve. It's good to be back here at this particularly difficult time with the pandemic. This has been a really helpful platform for me to, I think, connect with the business community, in particular in the Tri-Valley, but also just the community more broadly, and to hear from folks about what I know has been an extremely challenging year. So I do have a small number of slides. I don't think we've always done this, but we're going to share just a little bit of data about what's going on right now, and then launch into the questions. So next slide, please. So this is the daily reported numbers of cases in Alameda County in the blue bars. And what I will draw your attention to is on the far right side of the screen. You could see even in really very recent days, we are getting daily reports of cases far exceeding anything we have seen, even at the peak of our summer surge. And I will tell you, if we were to rerun this slide today, you would see a day where we hit 790 cases, so off the top of this figure, and another day where we were above 700. So unfortunately, this has worsened day over day, and it is far and away the worst moment in the pandemic in Alameda County. Next slide, please. This is the same information expressed as a rate. We use this to compare how we're doing to the state, the whole country, and other health jurisdictions. And so this is going back to May 1st. You can see we had a peak in the summer surge, a case rate of about 15. When this slide was made, we had passed 25. They calculate this with a bit of a lag. We're actually up around 32 or 33 right now, even with a lag, could go higher than that. So we're no longer in a place of congratulating ourselves for how well we've done. I will say that we have among the lowest rates in California still, which I think speaks to the sacrifices that everyone has made here in Alameda County to protect each other. And we have done, I think, still relatively well compared to urban counties across the country. But nonetheless, a very difficult time right now in terms of COVID. Next slide. So a bit of geographic data. This is just since October 15th, when we started to see the earliest increases, second half of October, kind of held steady in terms of policies right into the middle of November, where we were moved to the purple tier by the state. And that's the state's framework for local restrictions. So what you're seeing here is that in this most recent surge, as we saw previously, the most dense communities where people live in the most dense housing and where we have the highest concentration of essential workers, people who have to go out and sort of rub shoulders with their co-workers on a daily basis. That's where we see the highest rates. But what you can see is the whole county is impacted, and even all the way out to the eastern portions. And that part of Livermore that has the highest rates in the Tri-Valley area, that's kind of a purple tier plus level of transmission. So this is pretty substantial. I'd say that the next lighter shade is more kind of a red tier level of transmission. So pretty substantial case rates there. But the county as a whole is in quite bad shape in terms of rates. Next slides, please. So rates are one thing. As you all probably know, we do a lot of testing. The healthcare system does quite a bit of testing. The county supports various testing, but something like 14 testing programs throughout the county, plus mobile testing. We do about 40% of our 9,000 or so tests done per day. So, we certainly do a good job of detecting cases here. Some counties test more per population, including in the Bay Area. We're by no means leaders of the pack in that regard, but we do a lot of testing. So we also look at hospitalization as a burden of the pandemic in Alameda County. And also by this measure, we are far and away in the most difficult situation. This slide was prepared on this data through the 9th. We are at the 14th today. Today, you'll see it on another slide, we have over 300 people hospitalized with COVID. So that blue line on the far end there just goes up, up, up. And then the orange line, that's our ICU hospital admissions. We're up at around 90 today. So that also has worsened, and that's really what's driven our policy changes this time around, more so than the overall case rate. Next slide, please. So these are just the numbers. 300 people hospitalized with COVID in Alameda County. We had 213 on our worst day in the summer, and we're increasing every day in terms of number of hospitalized people. If there was one positive, the one good piece of news I have is that it's not increasing so fast that our healthcare system is overwhelmed yet. They're able to stretch, and they have capacity in terms of what we call floor beds for non-intensive care unit patients, and the increases are happening at a rate that they can sort of respond and have some time to plan. You can see we have plenty of available beds. I think what's more difficult is how much staff can be mobilized. We're in actually pretty good shape compared to the Bay Area, certainly compared to the rest of California, and really compared to a lot of the country. So the places that we normally look for extra healthcare staff are not there. Some of our large organizations planned ahead, so they're in a little bit better shape, but there aren't these kind of what we call registries of available nursing staff that we can contract with and bring in to, I mean, they're there, but they're tapped out. And so we have beds. The question is, how much staff do we have for those beds? And then in the ICU, further down the table, 88 people in the ICU as of the most recent data that I have available. This will go up on our dashboard later today. We also have some ICU bed capacity where we have a lot of ICU beds in Alameda County compared to our neighbors. For 450, give or take. Most of those are adult beds. We have some available. About 24% of our adult beds are available. The Bay Area regional ICU bed availability, as calculated by the state, and the state is using this to determine which regions are subject to state shelter-at-home orders. That's at 16.7%. It's been holding around that 17 mark for a couple of days. Next slide, please. So just a little bit more on that bed capacity. So our healthcare facilities are doing what they can to preserve ICU capacity, make sure that they're getting people out of the intensive care unit who don't need to be there. I don't think we've seen the full impact of Thanksgiving-associated transmissions on hospitalizations yet. And so, the next couple of days, I think that's when we would see maybe potentially an increased rate of rise. And then what's going on around the region is Santa Clara is in very tight shape, our largest county in terms of bed capacity, and it's a bit of a mixed bag across the rest of the Bay. So we used this information just over a week ago to try to determine where we were going in terms of ICU beds, because that's the place, I think, where Alameda County and a lot of counties are going to run into hospital problems earlier. And so we used a pretty well-established model to forecast what beds would look like if transmission continued at its current rate. So this is using estimates of transmission at around December 4th. What this slide shows you is numbers of people in the ICU for COVID going out to the end of January. And it provides, this is a computer model, it provides different possible outcomes. The purple line is a kind of average, the dark purple line, that's kind of the average forecasted outcome. That's like all of the possibilities are spread out around that kind of middle purple line there. And so that hits our 400 or so adult ICU bed capacity right around New Year's. And this was, again, run about a week ago. I've looked at more recent models. It's more or less held steady in terms of what it's predicting. So our goal was to say, well, we don't want to fill up all of our adult ICU beds with COVID because then we don't have room for heart attacks and strokes and other types of critical illness where people need an ICU bed. And so next slide, please. What we wanted to do was we wanted to cut transmission as much as possible to try to reduce the impact on hospitals and ICU beds. And this is what the model would predict would happen if we cut transmission in half starting December 7th. That's last Monday. You can see that the middle projection there, the dark purple line, the idea is we would not, we would flatten out right around 150 people in the intensive care unit. Remember, today we're at 90. So this is what we're trying to do. We're trying to keep the ICU from being overwhelmed by cutting down transmission of COVID in Alameda County before those beds and the staff available to staff those beds get overwhelmed. Next slide, please. So that was why we, along with Contra Costa County, Santa Clara County, Marin, San Francisco, and the city of Berkeley adopted the state's regional stay-at-home order early. We adopted it before we hit the state's threshold. We thought that was too low. And next slide, please. What that's meant is that we join now the greater Sacramento region, the Southern Central Valley, and all of Southern California in having these restrictions in place. In other words, virtually all of California, in terms of population, is now subject to these same restrictions. What you see on this map is the ICU bed capacity, adult ICU bed capacity in each of these regions. You can see we're doing a lot better than the other populated parts, or than the Southern Central Valley and Southern California, where there's like no beds left. But you know, the Southern Central Valley is just across the Altamont Pass there. So you know, we're a separate region, but we're not really separate from these other parts of the states in terms of what's going on. We just happen to be in a place where we have a little bit more bed capacity locally. All of these places were where we are now. That's where they were a few weeks ago. So as with everything with COVID, it's about trying to figure out where you're going to be in a few weeks and trying to protect the population from the worst possible outcomes. Next slide, please. I think I covered all this stuff, but I'll just say the goals of this are to stop rising transmission rates, protect the healthcare system, prevent severe disease, hospitalized disease, and loss of life. Stay-at-home orders have really been one of the only strategies, these kind of more broad stay-at-home orders, one of the only strategies shown to be successful here and around the world. There's other things that work, face coverings, that kind of stuff, but in order to really interrupt a surge, this is about the only thing, both locally, nationally, worldwide, that has really been effective at getting things under control. It's a different situation from where we were in the fall, where we're sort of picking and choosing high risk and low risk situations, trying to get stuff open carefully. That piecemeal approach has worked really well at lower levels of viral transmission to keep each other relatively safe. We've done well with that in Alameda County, but it's totally inadequate for what we're facing right now. And so that's why that's why we are where we are. Our hope is to get this lifted as soon as things stabilize. We set a goal, an end date for the order for January 4th. So we're a week into basically 4 weeks of this. If we hit the state's threshold, which we haven't yet, and I hope we don't hit it, then we're subject to the state's order, and we'll be released when we meet their criteria. But my hope is that we manage to get things stabilized before that. That gives us a little bit more local control, and we'll be able to get back to reopening sooner. Next slide. Key restrictions. You know, what's important about this is people just need to stay home. It's not about this setting or that setting. It's about staying home as much as possible. The state's carved some things out. I think the state's done okay. We've matched it because we think that's the most straightforward, and that's what our neighbors have done. I think it's pretty good. It's not perfect. But all these things that are closed that we want to open, or what's the date, or all that, that's the point of this, is that people stay home. And the more things are open, the harder it is to have buy-in from it's hard enough as it is, as I think everyone knows, the harder it is to have buy-in from the public to do this, particularly during this holiday season. I hate to be in this position of doing this at this time, but this is where we are. Next slide, please. I'm going to switch gears very briefly, give a little bit of information about vaccine. This is the good news, the light at the end of the tunnel. I think the reason why it is my hope that this is the last time we are in this kind of level of restrictions, and that it is a question of weeks that we're in this situation only. Next slide, please. So it's been making the news. I'm sure many of you have heard about this. The FDA approved the Pfizer vaccine over the weekend for use, emergency use in people over the age of 16. There's another vaccine that's going to be evaluated in the next week or two, the Moderna vaccine. There are the Pfizer vaccine data is very good. It's very promising. The safety data is very good. They have several months of safety data now, and it's a real miracle that we're already having this conversation less than a year into this thing. But I will say, and I think the federal government has done some things well and some things not well. This is really the thing that they have done the best in the response, which is put everything in place to make this move as fast as possible without really compromising any standards or safety in terms of vaccine development. And we had the good fortune to have a few vaccine development platforms that were kind of perfect for this virus. That gave us a jump start at the beginning, but all of the trial procedures and analysis is totally up to snuff. I was just looking at the New England Journal article, peer-reviewed article about these results today. I read through all the FDA sort of, it's like a packet summarizing all the data. It's very good news that we're in this place. And so we have a prioritization framework that's set by the federal government, really focusing on this in the next few weeks, high-risk health workers. That means health workers that are at greatest risk of being exposed, also a subset of first responders. And then nursing home residents are separately a high priority. There's a kind of a dedicated program for nursing homes that the federal government has set up in partnership with some of our large pharmacy chains. And so these are the folks that will be getting these first doses of vaccine. And we expect to get them here in Alameda County, our first allotment of the Pfizer vaccine, about 14,000 doses in the next couple days, between the 15th and the 18th. We're going to move through these phases according to supply of the vaccine. I think in the coming months, we'll be able to move on to certain other critical workers, and then the general public will probably start being able to access vaccine later in the spring. It all depends on how quickly we can get supply out, and frankly, how many of these other vaccine candidates are perform as well and meet the criteria for emergency use authorization. Nonetheless, very good news. I can answer a few more sort of detailed questions about the vaccine too. Next slide. Just very briefly on our role, I think this is my last slide. So the rules are really set by the federal government with some state input. The state also had it, along with the other Western states, its own kind of separate advisory group of experts to look at all the data. They've signed off. They think FDA is right on the money with this. And so the state is doing a lot to lead the response here on the West Coast. But locally, our role is as follows. So, of course, engaging with community stakeholders about how this is going to look, how we can communicate about it, trust building, making sure that we maximize uptake. The vaccine only works if we take it. Also coordinating with our local healthcare delivery system, making sure they've got everything they need, their plans in place, their storage facilities ready to go. They're focusing on their high-risk providers. And then there's some logistics role that we have in terms of making sure we have enough of these cold, ultra-cold freezers for the Pfizer vaccine. That's not necessary for the Moderna vaccine. And working on planning for mass vaccination sites in partnership with cities and other important community stakeholders across the county. And just kind of making sure that things are moving. We don't want to waste any doses. We want to make sure everybody gets. These first couple vaccines are 2 doses. One, I think they're now saying 3 weeks apart in the final FDA approval, and so that there's some logistics involved in making sure that once you get one dose, you get the second one. I think that's my last slide. A lot to cram in, and I think we'll cover a lot more during the questions.
Okay. Thank you, Dr. Moss. It's a lot of information, a lot of important information, bringing us up to speed. We do have some questions in there. Inga, you want to take that first one? We're going to kind of do a round robin here on these.
Sure. From
Joya.
Dr. Moss, this is from Joya Yoga, one of our yoga providers, and they have a representation in all 3 of our cities. Dr. Moss, despite our lockdowns that severely impact our businesses and our local economies, why do we see this level of transmission? What's driving this spread? And then he had a secondary question. Do you want me to go ahead and pose that now, or?
Well, no, I'll start with the first one. So the virus spreads when people are together, when they're in the same place as other people, particularly when masks are off. But it's really crowding together that does it. And our restrictions have only been in place for a week. I mean, we were at purple tier before that, which was, I think, as we had seen locally and across the state, just inadequate for the level of virus that we had going here. I think there's a lot of reasons for this. One of them is we don't fully understand everything about how these waves work. We know what kind of happens at the individual level. We don't understand why it's kind of moving in these waves, but also I think people getting tired of all the restrictions, as I'm sure they're even more tired now, a week into our shelter-at-home order, leading to gathering together and spread of the virus. But so that's why I think where we are is the virus spreads from person to person when they're near each other. And then the second question
is, what is the percent? I'm not sure if you answered this. Yeah. What is the percentage on average of total COVID patients in all the Bay Area ICUs as well as Alameda ICUs?
What is the
percentage on average of total? I'm not sure what he's asking.
Yeah, read it again.
Maybe. Secondly, what is the percentage on average of total COVID patients in all of the Bay Area ICUs as well as Alameda's ICUs?
Yeah. Okay. So of adult ICU beds, I think it's roughly 40% right now. It's been bouncing around a little bit, 44% for Alameda County. I looked this morning. But if you include pediatric beds and some other things, the number is lower. I think it's on our dashboard. Percent, you can find this on our dashboard. COVID percent of total inpatient beds, it's just Alameda County, is 11%, and ICU staff beds is 17.5%. But if you just look at adult ICU beds, it's like 40% are COVID. So I think that answers the question. I'm sorry I don't have it for the whole Bay Area. I can try to look that up on the call and see if I can find a number for that. We're a little bit better than the Bay Area, by the way, with this because we have a lot of beds.
Mm-hmm.
Dr. Moss, thank you again for your presentation. I think, and you're well aware of this, that our business community, specifically the restaurants, the salons, they were getting hammered before. Now they're really getting hammered. And I guess what they're concerned about, what they don't understand, and it's just ironically, I got an email from one of our restaurateurs while we're on this webinar, is they have followed all the protocols. And they are, in their mind, providing very safe and secure outdoor dining. And then you see some of the shopping malls with, I don't know if you saw some of the social media pictures over the weekend, but there are hundreds of people walking around inside these malls. not doing any of that, and they just don't understand why they can't continue to serve outside when this is happening in other places. So, is there any
Yeah.
way that you would consider changing that protocol in any way to allow them to survive?
Yeah, I mean, I think I cannot put myself in the shoes of the restaurateurs and other businesses that have been so impacted by this, but I am hearing, many people have reached out. I know this has been just an existential challenge. And so again, I think what's important here is we're not in this like, well, this is safe and that's not safe. Movie theaters are safe this week and bowling alleys aren't. We're not in that phase right now. This is everybody's got to stay home as much as possible. And so it's not, the things that are open for the most part, and again, we're just sticking with the states here, the states rules here. I think they're pretty good. They're not perfect. The things that are open for the most part are what are considered essential, things that people need to kind of put food on the table, get through their day to day. And the retail is 20% capacity. Retail is allowed to open 20% capacity with metering. So they should be at the front door, counting how many people go in or out. And the reason that it's not more restricted is my understanding from the state is that it was too hard. You can't, they weren't in a place where they could reliably and consistently say, well, this type of store must close, but that type of store can stay open, because there are too many types of retail establishments that sort of cross too many, cover more than one thing. But they all should be metering in order to be compliant with the law. The number of people going in or out has to be 20%. I understand it's confusing, and I don't think my explanation probably doesn't make people feel any better. What we're really trying to do is keep people at home as much as possible. And I think the state felt that the benefit of having retail open for essential needs, outweighed the was required that they allow at least some retail, but again, 20% capacity. But really, all leisure type activities have been restricted, and that's just the idea is that people have to stay home. They have to stay home. I think the other thing that we've tried to do all across the region is just stick with what the state has said, and they're still tinkering with it because of all the confusion that has come. And not that this isn't confusing, but all the confusion that has come when we've done things differently from the state in the past, or when we've done things differently from Contra Costa County in the past. Mm-hmm. And that wasn't, we always felt like we were making the best decisions for the public health of Alameda County. I think the state has done a pretty good job here, and this can work. But it is not perfect, and there's just no way around the fact that this is very difficult for businesses that cannot operate.
Thank you. The next question is, you mentioned you are still seeing cases from Thanksgiving, which was 3 weeks ago. If quarantine is about 14 days, if you were exposed, do you think that should be extended?
Let's see. So Thanksgiving cases. So I think what we're seeing, I mentioned we had a couple days with like 800 cases, which is a number that we hadn't even dreamed of before previously. And I'm not sure whether it's impacting our hospitalizations yet. That is usually delayed a few weeks. So around now is when we would see impact of Thanksgiving on hospitalizations. And so I think we have seen an impact here. I know that other people have seen this similar. We were already increasing, and then it kind of we unfortunately took a hard turn in the wrong direction over the last 7 days or so. So I think we are seeing that. I think it's too soon to say we've seen the full impact of that on hospitalizations. And the other thing about Thanksgiving cases is you have to remember, when there's an acceleration like this, this happened, I have to say, be honest, in my own extended family, not my immediate Thanksgiving, but one person got it, two people got it, then they exposed a bunch of people. It was after Thanksgiving, but it was because of the Thanksgiving cluster, and so it takes some time for the oh, I've frozen. Are people still hearing me?
Oh no.
Yes,
Okay.
we can still hear you.
So I think I was spending too long basically saying that I think the full impact has not, we haven't seen it yet. In terms of quarantine, the state, I'm not sure if it's posted yet. The state looked at CDC's new quarantine guidance and posted their own, and we're trying to look at that, make sure we can come into full alignment, see if there's any wrinkles we need locally. That will allow certain, like a 10-day quarantine under certain circumstances, so a little bit shorter because there's some data suggests that that's generally safe. The risk is not quite as low as with a 14-day quarantine, but that's not necessarily tied to Thanksgiving. It's just trying to make this a little bit more bearable for people who are exposed.
Okay, I think it's my turn. We've heard that the Pfizer vaccine is not, some people have heard that the Pfizer vaccine is not good for those with asthma. What are your thoughts on that? And I suppose I could kind of expand that and say, are there any people that maybe should talk to their doctor and might not be candidates for a vaccine?
Good question. So that I'm not aware of. It's what I'm aware of, and a lot was released over the weekend, and I was unfortunately handling some other COVID-related business over the weekend, so I didn't get to join all of the CDC calls. So this was my understanding from reading the published materials and hearing about these. There was two people in the United Kingdom who had a history of anaphylaxis. It's where like your throat swells up. These are people who carried EpiPens already because I don't know what their allergies were to, bee stings or something like that. I don't know. Not asthma, but anaphylaxis, and they had that reaction with the Pfizer vaccine. And I'm not aware of other cases of that at that time. But I think what the FDA has done is said that some care needs to be taken with people who have that kind of history in terms of vaccine administration. I think that there's I don't know that any of those people couldn't receive the vaccine, but I think that there'd be some maybe additional safety requirements for people with that history. And I'm sorry if I don't have the exact language of what CDC said. I just haven't caught up to that, and things are moving pretty fast. I think in terms of people with a history of asthma, I'm not aware of any particular issues there. I urge everyone to look at the CDC and the FDA's resources about the vaccine. That's where you're going to get the most factual information in terms of what we know and what we don't know. We'll learn more as it's out in, many more people are going to get it now, and we will learn more. My understanding is the greatest issues that were seen in the trials was that people, they feel crummy for a day or two, especially after the second dose, but even after the first dose. Now, it's interesting, even people with placebo felt crummy after they got the vaccine. You get a shot with salt water in it, and you still kind of get a headache and feel flu-like for a day. So you have to bear that in mind. There's always a psychological component to this, for lack of a better term. But yeah, I think people feel kind of flu-like for a day or two after the shot. They get arm soreness. That seems to be for real. And then there are people who are not included. There's just not enough data on people of certain types of health conditions. So for example, pregnancy. It's kind of a woman's can discuss with her provider whether it's appropriate and whether she chooses to get the vaccine or not. We just don't have enough data to know whether there are long-term ill effects. My understanding of the way this vaccine works, I don't have any I don't think there's any cause for concern going in, but they're just things that require more. We just need more data before we can the final word. So, maybe we'll learn more about asthma as we go. But I think for right now, I'm not aware that that's a challenge. And I tried to throw in some other vaccine knowledge in there. Maybe I'll speak to some other questions.
Thank you, Dr. Moss. I think I'm next. First, I have two questions. One, will you take the vaccine?
Absolutely. I can't wait. It's to be
Okay.
so great to have that behind me. Still going to wear a mask because actually what we don't know yet, I'm sure I believe Pfizer is just waiting to share this information. They haven't shared it yet. We don't know we know that the vaccine prevents illness and severe illness. What we don't know is the degree to which it keeps people from shedding virus. And so I think we'll learn that pretty soon, but we don't have that yet. So I'm going to keep wearing a mask once I get the shot. But I'm not looking forward to having a headache for a day, but I'm looking forward to being immune to COVID. So roughly a 1 in 200 chance of dying if you get it. I'll take the vaccine any day over that.
And that leads to the question in the chat. You kind of answered it. Once you get the vaccine, how long until you are fully protected? How long does it last? And should you continue to wear face masks?
Yeah. So I covered face masks. I think we're going to be living with hand washing, face masks, caution for a long time. I have to be honest. It is my goal to the greatest extent possible get things back open as soon as possible. And I think it's going to be very hard for us to live with all of the risks, particularly what we have right now, but even what we had in the fall, especially as the vaccine rolls out. So. I'm looking forward to more and more openings, but I think masks, hand washing, limiting, the size of gatherings, even when we get back to gathering together, that's probably going to be with us for some months, maybe throughout most of 2021. So I think people should prepare for that, even after they get the vaccine. In terms of the duration of the protective effect, I think we have, I don't know, months of data right now, but we don't have years of data. So we don't really know over the long term what will happen. I can tell you in my experience with other vaccines is that the protective effect lasts for years. And sometimes there are vaccines where we end up needing a booster at like 10 years. Ultimately, with COVID, what we're trying to do is prevent severe disease and death. And so if you get the vaccine and 10 years later you get a cold, caused by this virus, but nobody really gets severely ill or dies, that's probably going to be acceptable. But if we find out that we need a booster to prevent people dying from COVID, then maybe that'll be down the road. And also, there's other vaccines out there. There's more candidates in the pipeline, and so they're all going to work a little bit differently, especially over the long term.
Yeah, I'm off mute. Here's a question about, please tell me, what is the youngest age considered an older adult?
Is the question with regard just in general?
I think so. Yeah, I think it might refer to the teens, where the cutoff is. So, I think that's been a question lately.
I'll answer it like this. When we look at the vast majority, let's see, among people who get infected, the risk of dying is higher and starts to climb for people over age 50. So that doesn't mean that because you're 50 or 51 that you're old. It just means that, and so I use the term older adults to refer to those who are in those older decades of life where there is a higher risk on a per case basis. But this doesn't mean young people are not at risk, because they get our highest rates of cases are in young people. So, the risk that any one person with COVID gets hospitalized or dies when they're younger, between the ages of say 20 and 50, is lower, but the number of cases is much higher. So we see a lot of 20 to 40% of our hospitalizations are younger adults. So I think, it's important when I use that language, I don't want people to walk away thinking only older adults are at risk. I know the question didn't get to that, but I like to throw that in.
Thank you.
Thank you.
I think it's my turn, but the chat has gone blank on me. But I do have a question that got emailed to me by one of my members who can't enter a chat. She said if she would like to know, she's with the bowling alley or bowling center. She'd like to know if we are in such bad shape, why are retail allowed open? She drove by the outlets, and very obviously they're not at 20% capacity. Only some businesses are being closed down, many since March. And then she also had a second question. How does the ICU capacity compare to last year's capacity at this time? So two things.
Yeah, so we are working, trying to work closely with our city partners and give them more levers in terms of businesses that are not playing by the rules. Because I know that for those who are, it's very difficult to see your neighbor flaunting and just going about business as if these restrictions didn't apply. And we've always taken a education first approach in Alameda County, and a lot of counties have done that, and that has worked well for us up to this point. But everything is more difficult right now, and so we are trying to come up with some additional options available. The first thing is always going to be to talk to a business, but there are some state resources in this regard. All the state regulatory agencies that have sort of regulatory jurisdiction over certain businesses, they're around. OSHA, Alcoholic Beverage Control, Department of Food and Agriculture, they're around and they're paying visits to people, so there's a few different options depending on the type of business, and I want people to know that I realize that we probably need to be doing more than we are, and we're trying to find ways to do that constructively. It's been a challenge, but some action is being taken. You can always refer any concerns, I think, to the relevant city manager. I think they like to know, or you can email covidcompliance@acgov.org, and that's our system. We triage to the city or to the other agency involved. It's not perfect, but that's a way that you can report compliance concerns. And there was another part of that question, right, Inga? Oh, how do we compare to prior years?
Yes.
Yeah.
Although, do we want to encourage? I have a question back on the other. Do we want to encourage people to? Do we want to encourage people to turn people in?
I'm just putting it out there as an option for people who have concerns about a business, and they're concerned for the safety of their neighbors, and I understand that it's of particular concern if you're a business and you're playing by the rules and somebody else isn't. But I don't know. I don't view it as turning somebody in. This is an option that's available. Some of these get followed up, some don't. It depends on all kinds of factors, or it's not that they don't get followed up on, but what the end result can vary quite a bit. So it doesn't mean that anybody's going to get hauled off in cuffs or anything like that. It's a mechanism that we have when people see things that concern them.
Yeah.
ICU
And the
capacity.
second question was, yeah,
Right.
last year.
Yeah, so I've asked for that. I don't have that. It's not in our dashboard comparing it to prior years. So like the question is, in December, what do ICUs look like in Alameda County? You got respiratory viruses, you got all the usual heart attacks, strokes, and car accidents, and things like that. I don't have those numbers, but I will also tell you that the hospitals themselves are doing things to create room, right? So they're getting people out. We haven't asked them to cancel elective surgeries, but they may be reducing the numbers, depends on the facility and, those kinds of things. So, the hospitals are actively trying to make this work, where they don't get into trouble themselves. It's their staff and their facilities. And so, I think that factors into any comparisons that we would make. But I will tell you from a COVID standpoint, I think we're twice. I think we probably peaked around 60 or 70 ICU COVID cases in the summer. So at 90, it's worse. It's not twice as bad, but it tends to lag cases and hospitalizations by several weeks. And so I don't know how high we'll go yet. My hope is that it stabilizes. I mean, that's what we're trying to achieve.
Okay, I think I'm next. So this goes back to this is from Herb Ritter. He's wondering, where are our local leaders getting the data that show, in quotes, orders and closing businesses reduce transmission? According to some statistics that he has, 74%, according to New York statewide data, around household social, where restaurants are only 1.43%.
Yeah, well, it's very easy to identify a household transmission and very hard to identify a restaurant transmission. But actually, the data that we're using to inform this policy is the data we have locally, that from our own experience locally in the spring, and also from around the world, that shelter-at-home orders are very effective at limiting the COVID surges and limiting the impact in terms of hospitalizations and loss of life. So that's the data that underpins the policy. It's not about, we're not relying on data that's for, individual business sectors. What we're relying on is the fact that shelter-at-home policies have been one of the few things that has got things under control with COVID. Households absolutely amplify COVID, because you can't separate. You're in the same airspace as somebody for hours and hours and hours. You can't separate. It's hard to wear masks in your house all day long, and so that's been true since the beginning. But I don't think that we want to keep COVID from getting into those households. And the way we're doing that is by having people stay home with their own household instead of mixing with others in a large range of areas. That is what we're trying to do here. We're trying to do it over a short amount of time to get things under control. And then my hope is that if we're able to do it, if people are able to stay home effectively, and I think that's obviously a challenge for a lot of folks right now, especially during the holidays, that we will get things under control and get back to reopening. And I'll just add, we've been living with COVID for a year, almost 10 months here in Alameda County. This is the worst that it's been. If not now, when would we do this? This is the time to take this kind of action to save people's lives. Otherwise, just letting the chips fall where they may, all that we've done all year is sort of, what was the point of everything if we're just, when things are at their worst, we're just going to let it happen. I don't see the logic in that personally.
Mm-hmm. Mm-hmm.
And when
Yes.
a vaccine is around the corner.
So let's get through some of these questions, because I think we can definitely have a conversation about the impacts as a result of the economic impacts as a result of the pandemic later. But there's a couple questions here related to the vaccine, and one relates to the elderly that are homebound residents and how part of the strategy that the county is developing, or maybe the region, on how to get the vaccine to those individuals or to transport them to where the vaccine is. And when do you anticipate the vaccine being available to phase 3 and phase 4 recipients?
Yeah. So in terms of homebound elderly persons, I think so. This has come up because skilled nursing facilities have been prioritized by the federal government, CDC's Advisory Committee on Immunization Practice, ACIP. So they set the final sort of federal guidelines in terms of who gets vaccinated, the phases. And that group was very high up. And the reason for that is it's a congregate setting, so COVID spreads really easily, right? I've been doing my spiel about keeping people from gathering. But if you live in a nursing facility, it's very hard to keep from gathering. I mean, you keep people in their room. We have all kinds of procedures, but you're living with people and in fairly close quarters, and so it's high risk from that standpoint. And people are very old on average, and they have medical comorbidities on average. And so it's just an extremely high risk setting. Now, older adults who might be receiving supportive healthcare services, have comorbidities, be high risk in other regards, but who live at home, the good news is they're at home. So their exposure risk is a little bit lower than what we see in those other settings. But they're still pretty high priority because, those are the folks who, if they do get COVID, are most likely, for those who get infected, to end up in the hospital and to pass away from it. And so we've had some of the organizations that work with this community reach out to us. I don't have a time frame. They're going to be pretty high up as being, just in the existing priority scheme anyways. But I don't know if it's weeks or months. It's probably a couple months, late winter, early spring would be my guess. But this is all contingent on how much vaccine gets delivered and when, and how quickly we're able to deliver it to the various priority groups. I think the general public, it's going to be stretched out over quite a long time, but probably as early as later in spring. General public, phase 3 will start receiving vaccine. Kids are going to be a while, kids under 16, because we don't have the approval yet, right? So we need some more data, clinical trial data, really controlled settings, and because kids have a lower rate of hospitalization and death, I think that's why the clinical trials thus far are focused on older folks, adults and older adults.
Okay, I have a question since you just mentioned rates of death. And you don't need to answer this if you don't want to. Is if someone goes in the ICU, what's the percentage of them coming home?
So I haven't looked at this in a while, and I don't have the number top of mind, except for adults aged. I don't have the numbers top of mind. For older adults, it's the mortality risk, at least from early data, for those who went into the ICU is very high. It was like approaching 50%. So critically ill older adults with COVID, if they make it into the ICU, there's a high risk of death. Now, things have got a little bit better. I think hospitals have done a little bit. We have some treatments. They're of, I would say, mixed efficacy, with the exception of steroid treatment for critically ill patients. That does seem to have some mortality benefit. And so I think that we have a few more tools in our arsenal than we did early on that might reduce the mortality rate for those at highest risk. For younger adults, I think it's something like, I I think it ends up being about one in 200 risk of dying, but I'm not sure how that breaks down in terms of the once you go into the ICU. And I just haven't looked at it recently. I'm sorry, I don't have that.
So that it's a good reason to continue with your protocols.
Yeah, right. Don't you love how I spent 5
even
minutes?
if you're in the younger group?
Oh yeah, no, I mean,
Because you
younger
have
people,
older
what
family
I will
members.
tell you, 20 to 40% of people hospitalized for COVID are people between the ages of 20 and 50. You are not immune to COVID. You can get it. You can get it. You can get sick. Of those, let's see, of younger, at least one study of younger adults who went into the hospital. So 20 to 40% of our hospitalized patients are younger, age 20 to 50. Okay. So what are we at today? 300 people in the hospital. 150 of those are people between the ages of 20 and 50. 20% of them are going to go in the intensive care unit. Most of them will come out again, but not all. So I think we've done a good job of convincing people that people who are older are at very high risk of this. We haven't done as good a job of letting people who are younger know that they also can get very severely ill, can be sick for months. They may pass away from it.
And they share the wealth with their older family members.
Yeah, I mean, I think people are really good about making decisions about their own health, but we really are asking people to keep each other safe in this. As long as the masks, keeping apart from each other, avoiding those holiday. I know this is the worst time of year to be going through this. Please do not gather with lots of family members over the holiday. Keep it to your household. I know it's tricky. We're having challenges in my own household, but this is the year to keep it small.
Thank you. I'll ask the one that Jody texted me on my next turn, because I can't see the chat questions anymore.
Okay, great. Thanks, Inga. So a personal question. My middle son and his fiance are trying to plan their wedding for next year. Should they have their wedding in the fall of 2021? And this is a real, actual situation.
I'm in that situation too.
I got married in 2019, right before COVID started. So I went through all this planning stuff, and I know you have to plan ahead. And we've actually probably some people who are part of your organizations. We've met with some of them about the challenges of the industry through COVID. Try not to predict the future. I would say things are favorable right now because of the vaccine, and I think the fact of the matter is, I would never rule it out completely, but I think it's hard enough to do what we're trying to do now. Like it's people. We're asking a lot of people, and I think the chance that we're going to be able to keep asking people to shut down like this in the future is lower. That said, weddings are a place where people pass COVID around, and so you can have a wedding. The question is the reception. My hope is there's enough vaccine out there that it'll be possible to do that safely in the fall. But I can't offer more concrete guidance than that right now. Small would be good. Have a small wedding in the fall and a giant party in 2022, maybe.
Okay, great. Thank you for that. And then a question from the chat. This comes from Tracy Fahard, our Visit Tri-Valley Executive Director. Please talk a little bit about resuming the blueprint tier restrictions once the order is lifted, and then are we starting over again? What would make our region trigger keeping in the purple? And will you keep moving together as a 5-county region again for reopening? So there's like 3 questions there. Sorry.
Yeah, I think we want to. I think the state it's much better system, that purple tier, red tier system. Not perfect, much better than it was. There are some things that they want to correct, but I think they also the rules have changed so much on people as it is. I don't know how much tinkering they're going to do, at least in the short term. But so the way it works is, if we never trigger, let's see. So we have our local stay-at-home order right now, and either that'll get lifted, maybe January 4th. That's when it's set to expire, or we will, if things worsen, we'll trigger the state's order, and then that order gets lifted when the state's projection of ICU bed capacity 4 weeks out. Yeah, let me back up. If we trigger the state's order, it's a minimum 3 weeks of state shelter-at-home restrictions, which are virtually the same as what we have right now in Alameda County. So minimum 3 weeks. And then at the end of 3 weeks, the state looks 4 weeks into the future and determines what the projected bed capacity of the region is. And if that projected bed capacity of the region is greater than 15% 4 weeks out, then the state will lift its order. So it's a little complicated. Once it lifts, the individual county's metrics for the tier kick in, and you will go immediately back to the tier for which you meet those metrics. So if we are meeting red tier criteria at that time, we will go back to the red tier. If we're meeting orange tier criteria at that time, and this is possible, and the reason it's possible is because the region gets released, but Alameda County could be doing better than the region as a whole. I think orange tier seems pretty far away right now, but we would go back, we would go right back to orange tier. We are likely to try to adhere to the state as much as possible when we do that. So we're not looking at a lot of extra Alameda County restrictions this time around. And so, it's my hope that things stabilize quickly and that we get released and we go back to purple tier. And then when the rates come down further, we'll go to the red tier and orange tier, et cetera.
Okay, so Dr. Moss, you just said something that raised a red flag for me. So we're not currently below the threshold of 15% in our region, right? But we have our
17%.
Right. But if we drop below that, then it triggers the state's stay at home, and it could add another 3 weeks?
Well, it depends when we trigger that. So the possibility is that if we hit it in the next, it'll be 3 weeks from the date we hit it. So that could be tomorrow. A lot of us thought we were going to hit it over the weekend, but we're holding steady at 17% over the last couple days. We were like 24% last week, so we dropped quite a bit. So if we hit it, then it's 3 weeks. And so if we hit it on, if it takes a week and we hit it next Monday, then it'll tack a week on at the other end. We would be subject to the state's restrictions until 3 weeks after that point. But my hope is if we don't hit it, we never hit it, and we lift our order and we avoid triggering it altogether. That would be the best possible outcome. If we hit it, then it's 3 weeks subject to those restrictions.
Okay, so managing expectations here, right? So then the next question, I think, sort of relates to your earlier answer on the blueprint and how we come back. So the outdoor dining, right? So that can happen in the purple tier, right? We were able to do some outdoor dining at a very reduced, anyway, it was the indoor dining, but outdoor dining can happen in purple tier if we're below 15% at the end of January 4th.
Once these stay-at-home orders are lifted, whether it's ours or the state, outdoor dining resumes.
Okay. Thank you.
And if we're meeting once we hit red tier metrics, we'll go right to the red tier permissions.
Mm-hmm. Mm-hmm. So it's really in the best interest of our business community, for the greater community, to practice the protocols. Our businesses are being responsible, and they're implementing all of the protocols and working really hard, protecting their employees and their customers. But the greater community, who's also affected, because then they cannot patronize those businesses when they're closed. It's a double-edged sword. They have the greatest influence on whether or not our businesses can reopen and begin to reopen to a level where they are sustainable and more.
Yeah, that's right. We have to cut transmission in half, give or take, right? So that means, people, I think people know what to do, and it's a hard thing to do, and it's been a hard year, but that's right. People need to stay home, and if they do that, we'll get out of this much faster. And if they don't, there's a risk of this dragging on for quite a long time at the levels of virus that we're seeing. And by the way, in the Midwest, our daily case rate is around 33 today, the most up to date. That's the number that I have the most confidence in terms of the way it's calculated. We're at least as high as 33 per 100,000 per day. In the Midwest, they got up to like 120 per 100,000 per day, right? So things can get much worse. If we get this under control now, and we get to a place where hospitalization rates are not climbing and they're stabilized, and we have the capacity, we'll be able to get things open up again faster. If our hospitals are overwhelmed, if we're having, what they saw, for example, in New York in the spring or in Italy early on, it's going to be hard from a public health standpoint to go back to anything like business as usual until things stabilize. So earlier is better. That's why we made the move we did, and that's why our neighbors made the moves that they did. And I think I'm hopeful people are able to make it work, and that'll get us back to reopening much faster.
So what you're saying is we're just trying to really flatten the curve so we don't get overwhelmed in our hospitals, so the doctors don't have to make a hard choice.
Yeah, I mean, it's the same
between one person and another.
Same exact goals that we have had since the beginning, which is to flatten the curve, protect the healthcare system, protect our medically vulnerable population, and this is, it's what we've tried to do all along. It's just that this is the time when those things are most threatened, or have been most threatened since the beginning. We know a lot more about COVID than we did in March, but we still haven't, the only things that seem to really work for these surges are these kinds of larger scale shutdowns.
Okay, so the question I have from the chat is, you showed a four-phase vaccine rollout. How will you verify if a person is in their appropriate phase when they come to get their shot?
That's a good question. I think what might be helpful is that we actually, maybe next time you meet, we could have one of our vaccine planners come on and speak a little bit more detail about where things are. A lot of the stuff is still getting developed because, when was it? Maybe a month ago or 6 weeks ago, we didn't even know that the vaccines worked. And so I think some aspects of the, especially stuff down the road, is still getting figured out, right? It's just, we don't have the systems fully gelled. And so I think it's very important that we, one thing we want to make sure is that we're getting the vaccine to the people who need it first, and we're sort of focusing on that. But you do have to, there has to be some process for verifying that. I don't have details today to share, partly because we're only just figuring it out, partly because we have a whole team of people who are living and breathing this. I've fortunately been able to kind of float alongside. So if it's helpful at a future meeting, if you want to have one of the vaccine planners come in and sort of go into detail, we'll probably have a lot more to share at that point. And it is going to involve a lot of community involvement anyways. So maybe, I don't know if that's of appeal. But.
So noted.
That makes an answer.
Next question, Dr. Moss. Between the state county guidelines and the new Cal OSHA regulations, there is much room for interpretations. Even attorneys interpret things differently. Nothing new there. Who can employers reach out to for answers to those types of questions?
Attorneys.
Okay.
Here at our office, it's the COVID recovery team, Eileen Ng, who I'm not sure if Eileen has joined me on one of these calls before, and her team, they're the ones who really are working to try to support businesses through all this stuff. And so COVID recovery at acgov.org. You can email your questions, and people are always welcome to try to ping me, and I can connect you to that team if it comes through the chambers, for example. But we are trying to continue to move into as much alignment with the state as possible, and I think for some of the OSHA stuff, we can't, the state regulations are the regulations. And so some of this stuff is pretty new, and we just haven't updated all of our documentation yet. So when in doubt, I would call COVID recovery or email us. And I think otherwise, if it's not crystal clear from us, I would follow the state guidance. Yeah, if there's not something that says this is what you do in Alameda County, I would default to the state.
And we have here a question. There are a list of severe versus moderate existing medical conditions to qualify at-risk vaccine recipients. Is there a list?
If there is, I haven't seen it yet. There might be. There are certainly things that are considered known to be, higher risk for severe COVID disease, heart disease, obesity. I think cancer diagnosis is in there, and so diabetes. So, there are some well-known associations with COVID. There's probably some other things that are going to be included because of, just because we know that those are the types of folks who do poorly with intensive care unit respiratory disease. But I don't have the list in front of me. I would look at CDC's resources on the vaccine. I know CDC has taken some heat over this, and there's been a lot of politics, but it's a pretty good resource for a lot of things, and I really encourage people to take a look. And they have stuff for the general public on there, so they'll have a lot on the vaccine and who should get it and when.
Yes, and we have our website. We put up livermoreupdates.com, which we set up as a resource for businesses, and we have a page there which has all the official information from CDC and the state and the county and any local ordinances. So we would direct folks there. And I think some of my partner chambers also have similar resources. Everybody gets their information from a different source, but you want to make sure that it is reputable. Yeah.
And I'm sorry, I'm not a total expert on it yet myself. It's just like literally this weekend there was 8 conference calls that the federal government organized about vaccine. I was able to join one.
Wow. Okay. So,
Okay,
go ahead, Inga.
go ahead. I have a question. Do you have data on per industry of cases? If certain industries are shut down, I think this data should be shared with the public, is the question.
Yeah, and this is something that gets asked a lot. The answer is we do not, for Alameda County, have data where we can say a transmission happened here and it didn't happen there. And the reason is most people have multiple possible exposures. And unless there's a confirmed case where they said, oh, it was that person over there that I was around and they have COVID, then we just don't have that. And we are not set up at the local level to even have that, nor are most public health departments. There's a lot of published data about areas that are high risk, and I think it's very good. There's also a lot of published data about settings where outbreaks happen, and that's also very good. And that's collected in different ways from what our day-to-day is. And so if you're looking for some local public health data that says it was here and not there, that isn't how our surveillance systems work. And I know that this is, when people see the policies, they want to see that data. But the policy right now to stay at home is based on our experience with these global stay-at-home orders. It's not about this industry or that industry. When we were in the reopening phase in the fall and we were picking things that were higher risk and lower risk, that's guided by published data on where outbreaks happen, what we have very good data on the way COVID transmission works, and what we know about those settings. And I think that it wasn't perfect because there isn't a published data on bowling alleys, for example. There's a lot of data on indoors versus outdoors and eating versus not eating. And there is actually a lot of data on restaurants out there. But again, it's not our local data. The surveillance data just doesn't have that. It's too hard to determine those on the individual level. You need academic, like university epidemiology teams to go in and figure that out. When people have done that, they have provided very useful information that's published, and we have used that to guide policies. But again, right now, what we have is evidence that shelter-at-home orders work to get surges under control. That's what we're doing. So it's not about this industry or that industry. It's about keeping people at home and from gathering in any setting as much as possible. And the state has exempted some essential settings.
Well, I think what you just said is a good close for what we've been talking about. I think we've covered all the questions, and I've received a couple other ones from the restaurant community. And I mean, at the end of the day, we really need to follow what you're saying to lower the curve so we can start opening up our businesses again. So again, from the Pleasanton Chamber of Commerce, we appreciate your hard work, your team, and thank you for joining us today. So I'll give it back to Don and Inga for any closing comments.
Inga?
He disappeared. Oh, there he is. Thank you, Dr. Moss, for your time today. It's always very informative, and I fill up several pages of information, and I really appreciate your time and the insight, and hope to see you again soon. Have a Merry Christmas.
Mm-hmm. Mm-hmm. Thank you, Dr. Moss. As always, we appreciate the work that you and your team are doing to keep all of us safe, and we appreciate you and your team listening to our business community in the various sectors and having those conversations. Having access to you is so important. It's a two-way street here. I just have one comment, and it's not to be critical, but I've just been thinking about this and I wanted to get it out. When the governor announced the impending stay-at-home order, and then we kind of managed our expectations built around that and the information that we had. And then 2 days later, our 5 Bay Area counties decided to go early. We understand the rationale for doing that. But many of the businesses were completely not prepared. And I know you've heard this for 10 months. We need to plan, prepare. We now understand that there's no absolutes, and you can't give us an absolute on this date. You can open fully or 50% or what have you. But I just want to flag for you and your team that the further ahead that we can be notified that you're considering maybe going a little early, then the better we can prepare. Purchasing products, scheduling people, then we know we can, pivot, because we're getting pretty good at it, but not with 24 or 48 hour notice. If you would just keep that in mind, hopefully we will not have to go there again after we do emerge out of this latest stay-at-home order. But I do want to flag that for you so you can just kind of, keep that on your radar going forward. And thank you so much for being here. We'll get you on the calendar in 6 weeks when the vaccine has been out there for 6 weeks, and have your staff person on the vaccines join us, and anything else that will develop within that time. But really, we truly appreciate you participating and being here for our businesses. Thank you.
Thank you all, and thank you to the residents and all the businesses for all that they have done. I'm enormously grateful for their sacrifices. So thank you for having me.
Okay. Thank you. And this will be posted. This recording will be posted on our chamber websites within the next few days. So thank you, everyone, for participating.